Now, Nashville's new numbers don't match a state trend we were mentioning to you moments ago. Metro Health officials confirmed 164 new cases of coronavirus in Davidson County. More than 730 cases were confirmed. No deaths were reported in the last 24 hours, and we now have more than 14,600 total cases. More than 9,500 people have recovered.
And while that seems like a promising trend, fewer than 200 confirmed cases here, we do want to break down the numbers and compare them to the number of people getting tested. So let's take the numbers from the past 24 hours as an example. 756 more people tested. Out of those, 164 were positive, which means 21.7% were positive out of those 750 plus tests. So that is the highest we have seen so far in our county. Overall, more than 123,000 people have been tested. Out of those, 14,700 plus tests have been positive, which makes our positive results as a whole 12%.
So let's be joined now by Dr. Alice Jahangir. He's the chair of the Metro Coronavirus Task Force.
So, Doctor, we've disputed a lot of numbers, right? We're hearing a lot about this positivity rate increasing in Davidson County. Can you walk us through in layman's terms what that means to you compared to where we should be here?
Sure. So, I think here's the way people should think about it. Exactly as you mentioned, what the positivity rate is you take the total number of people that are positive and divide it by the total number of tests given. And so if the disease was heading downward, so the total number of positives stays the same or heads downward, and the number of people getting tested goes up, you would hope that positivity number goes down. Unfortunately, in the situation we're in right now, the number of people getting infected is speeding up. And so, as you mentioned, since we started testing in Davidson County, we did about 127,000 tests, and we've had a positivity rate of 12%. Now, a few months ago, when things were a little better controlled, our positivity rate was 9%. What worries me even more so is over the past week, when we conducted 15,000 tests, 18% of those were positive.
Wow.
So while we were hoping this would head the opposite way, it is heading higher and higher, which means there are more people infected, and yes, more people are getting tested, but there's more people being picked out as being positive in those tests. And so that is very concerning to me. The state is similar. The state has had, while their positivity rate is 7%, the past week they've been 9% positive. So it is heading up both locally and across the state.
And one of the things that we continue to report here each day as we get these numbers is the number of people who've recovered from the virus. So talk about what is considered someone who's recovered. How do we know that? And then how do we track it as well day to day?
Sure. So what was defined as recovered is 7 days after symptoms begin, the clock starts. And for the last 3 days, so 72 hours, a person has to have no symptoms, so no fever, no cough, no shortness of breath, without being on any medicines. Now, if they can go 7 days and days 5, 6, and 7, they don't have any symptoms, they're officially recovered. Now, if they're on day 7, they still have a fever or a cough, the clock keeps ticking until they go 3 straight days. So that's how you're defined as recovered. The other way the CDC defines recovered is if you have 2 negative COVID tests within 24 hours. That's not happening as much anymore just because I don't think people want to get 2 tests back to back. But so it really is that 7 days that we track. And the way we track them is we actually, through our contact tracing and public health investigators, actually have a subset of people that call people regularly, or some places do it electronically by sending them texts and so forth to check symptoms.
Oh, wow.
So we did some calculations today. We know Metro has had more cases over this past 1 month than we have in the first 3 months of this pandemic. So besides masks and social distance, what needs to change to reverse this trend? Do you know what specifically is causing this big uptick?
Sure. So I think what is so wild for me is over the past 2 weeks, we've had 4,700 cases in the city. If you go back when this virus started on March 8th, it took us 10 weeks to have the same number of people infected. And so what the things that we're tracking right now is, a couple of weeks ago, I told you there was a lot of the mass gatherings and parties and bars. That number is slowly starting to head downward, which I'm really happy about. I think some of the things we've implemented. But what you're starting to see now is still the highest numbers are amongst households. So your roommate or your spouse or somebody gets infected, that seems to be transmitted. That's about 23% of our cases. The other place that we're starting to still see cases is really at construction sites. So if you're somebody who works at a construction site or have a loved one that does, that's where this things we've talked about, masks, social distancing, it really matters. And so I think those two areas right now are where we're seeing most of our infections.
It really is frustrating. I guess we do have to go back to just doing everything we possibly can to stay healthy. Dr. Alex Jahangir, thank you so much.